This is a difficult but very important topic. Hi, it's Dr. Greg Jantz, counselor, educator, and author, 45 titles in the area of psychological issues, anxiety, depression, addiction. And here we are today talking about a topic that is difficult: trauma and sexual dysfunction and how this affects relationships. I do want to mention, as the founder of the Center, A Place of Hope, through the years, certainly it's been many, many individuals who have come seeking help for trauma. And one of the effects of trauma in their life is sexual dysfunction, sexual issues that can come because of emotional trauma or past sexual trauma. And so this is a very real issue. Trauma affects the whole person: mind, body, and spirit. I'm going to just talk about the issues that sexual trauma can bring up, and there's many. But there's an emotional detachment. It's that I just can't seem to get close. I can't feel close. What should have more meaning to me doesn't. There's a disconnect. And so to feel close or intimate can be a great challenge. There's the fear, the anxiety of being vulnerable in a relationship that can lead to such high, intense anxiety that the desire to be physically intimate is overwhelmed by the anxiety, which can be the number three here, is the lack of desire. Those that experience trauma really describe a lack of desire for physical or sexual intimacy. The painful memories that can emerge from past trauma, flashbacks that can occur, so the memory interference that can happen, and that just can bring, again, back physical pain as well as emotional pain. You have to have major trust in healing. And this is certainly something that I'm going to say that needs professional intervention. Going through a program like what we have here at the Center, A Place of Hope, is highly recommended. We've got to have resolved the trauma, which begins to resolve in other areas of our life. There is trauma-focused therapy, which is one of the things that we do. You've heard of cognitive behavioral therapy. All this is helpful, though it is not the one magic therapeutic intervention. There's going to be several. It's going to be the whole person. I'm going to just say there's a faith, there's a forgiving, there's a dimension of this healing that has to happen on many different levels. So we've got to be really patient with ourselves. We've got to seek the right kind of help. Some have said, I went to counseling, didn't really do that much for me. We've got to get the right kind of help. And also, I'm going to suggest an intensive period of time of help over the course of weeks is really what's going to work the best. So there's lifespan integration therapy. There's the DBT, dialectical behavioral therapy, just different tools that can be utilized and taught. There is also the role of forgiveness when there's trauma. I write about some of these things in my book, Triumph Over Trauma. Triumph Over Trauma. Also go to aplaceofhope.com. Look at the tab that says tests. There are several confidential tests that apply to this topic, which is also just a great place to start. And I got to tell you, there is hope. This is what we've been doing 40 plus years, and we see lives redeemed from trauma.